I'm Alicia, and today I'm going to present the 5 steps of the SHARE approach to using shared decision-making in a patient-provider interaction. This approach is from the Agency for Healthcare Research and Quality, or AHRQ. You can find more information and tools at the website on this slide. Shared decision-making is when a provider and a patient collaborate to make the best possible healthcare decision for that patient. Ideally, the decision takes into account evidence-based information about treatment options, the provider's knowledge and experiences, and importantly, the patient's values and preferences. A dialogue with a patient using the SHARE approach to shared decision-making should include comparing the benefits, harms, and risks of each healthcare option and thoroughly exploring what is most important to the patient. The SHARE approach employs 5 steps, each step beginning with a letter to spell SHARE to help remember the steps. S, seek your patient's participation. H, help your patient explore and compare treatment options. A, assess your patient's values and preferences. R, reach a decision with your patient. E, evaluate your patient's decision. In your core learning materials, you will find a quick reference guide to the steps and a poster outlining these steps that you can hang above your desk or give to colleagues. In 2006, researchers McCool and Clayman conducted a systematic review of the literature to identify the most frequently referenced elements of shared decision-making. The following 9 elements of shared decision-making were identified as essential. 1. Define or explain the problem. 2. Present options. 3. Discuss benefits, risks, and costs. 4. Clarify patients' values and preferences. 5. Discuss patient ability and self-efficacy. 6. Discuss doctor knowledge and recommendations. 7. Check or clarify the patient's understanding of the decision. 8. Make or defer a decision. 9. Arrange for follow-up. Shared decision-making is important because there are often several treatment options available to a patient. In these instances, patients' values and preferences are important for determining what the best treatment option is for a patient, especially if one intervention is not clearly superior to another. Done thoroughly, shared decision-making helps patients understand the benefits and harms of the options and clarifies their own values and preferences. It also improves the patient's experience within the healthcare system and improves patient adherence to treatment recommendations, which ultimately can improve health outcomes. For example, when a diabetic patient feels that they have actively chosen to begin insulin, they are more likely to complete their injection regimen. The shared decision-making process begins when your patient has a health problem that needs a treatment decision. Many healthcare professionals believe that patients are not interested in participating in their healthcare decision-making. However, evidence suggests that most patients want more information than they are routinely given by their provider. And many would like to be involved in making their own healthcare decisions. Remember, not every patient encounter requires shared decision-making, and the patient choosing not to participate in the decision-making process has still made a decision. The entire medical team should be familiar with and involved in shared decision-making. Of course, the patient is at the center of shared decision-making and is an active participant. Families and caregivers may also help clarify patient preferences or act as a legal proxy. The primary healthcare provider, such as the physician, physician assistant, or nurse practitioner, communicates that a healthcare choice exists and invites the patient to be involved in the decision. The provider presents the options, describes the risks and benefits of each, and explores patients' values and preferences. Other roles in shared decision-making include other members of the staff. The role of decision coach, a role many of you will play in the future, can be assumed by nurses, social workers, or health educators. A decision coach can help assess factors influencing patients' decisional conflicts, provide support to address decisional needs, monitor progress in decision-making, and screen for factors influencing decision implementation. Now, I'm going to walk through each step of the SHARE approach. This slide shows the poster that you have in your core learning materials. The poster can help serve as a prompt for you to use this five-step approach with your patients. You may find that you do not present the steps in linear order during your interactions with patients. For example, steps 1, 2, and 3 could all be going on simultaneously, but it is important to include all 5 steps. Step 1, seek your patient's involvement. Communicate that a treatment choice exists and invite your patient to participate in the decision-making process. Many patients are not aware that they can participate in making their own healthcare decisions. In addition, many patients are not aware of the uncertainty in medicine and how variable treatment outcomes can be. For example, even choosing one antidepressant over another could have different outcomes and extremely variable side effects. Let's go over some tips to help you invite your patient to participate. Summarize the health problem clearly and communicate that there may be more than one treatment choice. Ask your patient to participate with the healthcare team in the decision-making process. Help the patient understand she is being invited to ask questions, get answers, and discuss options with you. Assess the role your patient wants to play in the decision-making process. Provide ongoing cues during the interaction about why their input is so important. For example, say, "I would like your input." Ask your patient if he or she would like family and caregivers to participate. Here are some conversation starters to invite your patient's involvement. Can you imagine using them? Now that we have identified the problem, it's time to think about what to do next. I'd like us to make this decision together. There is good information about how these treatments differ that I'd like to discuss with you before we decide on an approach that's best for you. I'm happy to share my views and help you reach a good decision. Before I do, may I describe the options in more detail? Step 2, help your patient explore and compare treatment options. This step involves discussing the pros and cons of the treatment options. So the provider's knowledge about risks and benefits of a treatment is very important during this step. Tips to help your patient explore and compare treatment options include: assess what your patient already knows about the options. Some patients gather their own information. Explore with your patient what he may already know about his treatment options. List the treatment options and describe them in plain language. Clearly communicate risks and benefits of each option. Explain the limitations of what is known and unknown about the options and what would happen with no treatment. Offer evidence-based decision aid tools whenever possible. Summarize by listing the options again before moving to another step. Here are some conversation starters for helping your patient assess pros and cons of treatment options. Would you be comfortable using these in a patient encounter? Here are some choices we can consider. Let me tell you what the research says about the benefits and risks of the medicine that you are considering. I have some booklets I want to give you that have information about your condition and the treatment options. These tools have been designed to help you understand your options in more detail. Step 3, assess your patient's values and preferences. Some healthcare providers may not be aware of the outcomes that matter most to patients. In fact, studies have shown that healthcare professionals aren't truly tuned in to the things that really matter to patients. And other studies have shown that patient treatment decisions often change after patients become well-informed about their available options and the associated risks. The best decision for your patient is one that takes into consideration his preferences and values. Talk with your patient about what matters the most and what outcomes are the most important to him. Some tips to accomplish step 3 are: encourage your patient to talk about what is important to him regarding the options. Use open-ended questions. Avoid questions with yes and no answers. Listen actively to your patient. Show empathy and interest in the effect their problem is having on your patient's life. Acknowledge the values and preferences that matter to your patient. And come to an agreement on what your patient prefers. Here are some things you can say to get the conversation going about your patient's values and preferences. Assessing preferences matters, especially when patients defer decisions to clinicians. Finding out what matters to the patient may greatly impact achieving satisfactory health outcomes and patient satisfaction. When you think about the possible risks, what matters most to you? As you think about your options, what's important to you? Which of the options fits best with treatment goals that we've discussed? Is there anything that may get in the way of doing this? Step 4, reach a decision with your patient. Making a decision may take time. Check to see if your patient needs more time to consider the options or to discuss them with others. After assessing the treatment options and guiding your patient to express what matters the most to her, decide together on the best treatment option. Your patient may choose to delegate the decision to someone else or decide not to make a decision. In that case, active surveillance may be the option. Tips to help move your patient to come to a decision after jointly talking about the pros and cons of the treatment are: ask your patient if he is ready to make a decision or if they have any additional questions. Ask if he would like additional information tools, such as decision aids, to help make a decision. If more time is needed and the situation is not urgent, schedule another session. Confirm the decision by asking your patient to describe the option he chose. Schedule appointments to carry out the preferred option. Here's some dialogue to help move your patient to a decision. I hope you are beginning to imagine how a conversation might look on your rotations. It's fine to take more time to think about the treatment choices. Would you like some more time? Or are you ready to decide? What additional questions do you have for me to help you make your decision? Now that we had a chance to discuss your treatment options, which treatment do you think is right for you? Step 5, evaluate your patient's decision. For patients facing life-threatening conditions, some of the decisions will be irreversible, so careful follow-up is needed during the treatment phase. For decisions related to management of chronic disease, the decision should be revisited periodically. Some tips to aid in evaluating your patient's decision are: make plans to review the decision in the future. Decisions may be reviewed and changed if they are not working well. Monitor the extent to which the treatment decision is implemented. The patient, not the healthcare provider, is generally responsible for implementing many of the decisions that are made, particularly decisions made in a primary care setting. For example, lifestyle changes or taking medications. Patient adherence to treatment plans is enhanced by shared decision-making. Help with managing barriers to implementing a decision. Provide access to self-management support programs or other resources. Reconsider other options if the preferred option is not working. To let your patient know that you will continue to evaluate the decision that was made, keep the communication avenues open by saying something like what you see on this slide. Let's plan on reviewing the decision at our next appointment. If you don't feel like things are improving, please schedule a follow-up visit so we can plan a different approach. Let's briefly review key takeaway information for this module. Shared decision-making is a two-way street. It occurs when a healthcare provider and a patient work together to make a healthcare decision that is best for the patient. The optimal decision takes into account evidence-based information about available options, the provider's knowledge and experience, and the patient's values and preferences. The SHARE approach is a 5-step process for shared decision-making that includes exploring and comparing the benefits, harms, and risks of each healthcare option through meaningful dialogue about what matters most to the patient. This concludes the overview of the main points of shared decision-making using the SHARE approach. Thank you for your attention.